start off with a few remarks, and then we'll just open it up. We got to pass health reform this year, and I'm on the Health Committee, Health, Education, Labor, and Pension Committee. I got there late. It was a little matter of, it was a very close election. But I knew I was going to be on the Health Committee, and it was very frustrating for me because the markup of the bill, the writing of the bill in health really happened almost solely before I got there, and then I got there and I didn't become a member of the committee for about 5 days because Sheldon Whitehouse of Rhode Island, who is a terrific colleague, had taken my place, was holding my place, and they finished the markup with him, which is a sensible thing to do. So I had time to assemble staff, and I had a chief of staff, Drew Littman, and I'd asked him that I just be briefed on where the health committee was. And so Lauren was working on the health committee, on the staff of it. So we started talking about what was going forward in the health committee, and there was a lot of good stuff. We were talking about pre-existing conditions, and getting rid of insurance companies being able to deny people coverage who had pre-existing conditions. We're talking about bringing down the cost curve. We're talking about universal annual and year and lifetime caps, etc., and other stuff. And then at one point in the conversation, I just said, you know, this is something I don't hear enough about, and it's socioeconomic determinants of health and the tremendous disparities that there are in healthcare. And she went, oh, thank God. And so we got then we connected, and we really started talking about I imagine so many of the issues that we're going to be talking about today. You know, Minnesota, I'm very proud to represent Minnesota. Minnesota has some of the best, not only the best healthcare in the country and the world, but also some of the best delivery systems. It also and the healthiest people, but also some of the widest disparities. And I spoke yesterday to the Tribal Summit and talked about Indian health. And I'm on the Indian Affairs Committee, and this is something that just is very disturbing to me. And I talked about going up to Red Lake for my first powwow and having an amazing time, then being introduced to a young man, Buck Jourdain, the tribal chair, said, I want you to meet my son. And son had a friend who said he's in the Army. I said, what'd you do in the Army? He said, well, I was only there for about a month or so, but I got discharged with bad eyesight. And I saw he wasn't wearing glasses. I said, what's wrong with your eyesight? He said, I don't know. I said, well, you don't have glasses. He said, well, they were supposed to give me some glasses in the Army before I was discharged, but they didn't. And then I said, well, what, you don't know what's wrong with your eye? He said, no, and I didn't follow up. But this is very disturbing to me. Are there ophthalmologists that go to Red Lake? And so I just had a meeting with a number of the chairman and a number of members of the committee to start really, really looking at this. And this is what Lauren did. Lauren, father was head of pediatrics at Mayo, was educated at the University of Minnesota, and then got her doctorate at the public health school there, and worked on the issue of healthcare to underrepresented communities that are underserved. Now, there are certain things that are happening in the health bill And and there's a bill's been passed through the Health Committee, and there's a Finance Committee, I think, finished marking up their bill. There are 3 bills that have been passed through committee in the House. These are all going to have to be reconciled and finally voted on. There are some things that are in the health bill that I think you should know about. We're going to improve data collection and sharing. I know this is extremely important in communities that are underserved and tracking disparities. There is a dedicated prevention and public health improvement fund, and we the prevention title was written under the supervision of Senator Harkin, who's now the chair of the committee, although Senator Dodd, who's there for the whole markup, is still staying very involved in reconciliation of that bill, of the health bill and the finance bill. And there's going to be, and there are written into the bill, investments in workforce, so that in primary care physicians, in doctors who will serve in underserved neighborhoods, underserved rural areas, and underserved urban areas, school loan forgiveness. And so there are things written in to the health bill that I think with their eye on this. There's other stuff that's almost that has to do with clean water, clean air, safe neighborhoods, access to healthy food, mental health, making sure that there's physical education in the school, making sure that it's there are places to have recreation in your neighborhood. All these things that really, where you grow up, the neighborhood you grow up in, has so much more in many ways to do with your health care, with your health, than your health care or your doctor or your health insurance. And so this can't just be, healthcare reform isn't just about those 2 things, healthcare and health insurance. It has to be about a whole approach that addresses what we're here to talk about.